Professor Latha Venkatesan is the principal of the College of Nursing, All India Institute of Medical Sciences in New Delhi. She's a multi-award-winning nurse educator with over 3 decades of experience in nursing, which spans from bedside to leadership roles. An inspiring nurse educator who's involved with multi-academic organizations and universities in India and abroad. She is the core committee member of NABH for Developing Nursing Excellence Standards, Education Committee member for India Council of Nursing, Leadership for Change Fellow by International Council of Nurses, and a member of the multi-intergovernmental committees. She's published in reputed journals and authored textbooks for nursing students. Professor Latha is the editor and reviewer for several journals of repute. She's also part of a multi-country study to analyse the barriers of adopting evidence-based nursing. As the president of CNRS North Zone, she's initiated several projects, including this webinar series, to bring a culture of evidence-based nursing practice in nursing. Professor Latha adapted the evidence-based nursing game, an innovative learning tool for students to learn evidence-based practice in a gamified mode. Professor Latha was eager to have this conference to benefit students and faculty colleagues in nursing across the world. So without much ado, Professor Latha, if I can hand over the floor to yourself.
Thank you, Melvin, for the kind introduction and also taking the initiative to organize this wonderful conference, which will be really beneficial for aspiring Indian nursing students. So I have some slides. So, dear participants, it is my honor to present about the global migration trends of Indian nurses. What are the opportunities and challenges available? You know, the number of nurses graduating from India are in huge numbers. Around 3 lakh nurses are graduating every year. Of course, there are around 1,34,000 nurses who are completing general nursing and midwifery, which is known as diploma in nursing. And more than 1 lakh of nurses are graduating with bachelor's degree. And we have this 2 years of bridging course where the diploma in nurses can become graduate nurses. They are around 25,000 in number. And master's students are 13,000 graduating every year. So when these many nurses are graduating, what is happening to them? Where are they getting employed is the question to be answered. Many of them, of course, they try to get into government institutions, central government institutions, but then the vacancies are limited. Only 5,000 vacancies arise every year in central government institutions, and state governments have got around 2,000 vacancies every year. But then what else? What is happening to these graduates who are coming out every year? Then they look for getting employment in private hospitals and they migrate to other countries. And if you look at the nurses migration in India, if we view from the historical point of view, in 19th century, during the colonial period, the British nurses came to India and they started opening schools of nursing, and formal education was started in India. And in mid-20th century, people who studied here moved to UK. Few nurses had the opportunity to go and work in UK. Whereas only in the 1970s and 80s, there was a big surge to Middle East countries. Middle East countries employed Indian nurses and gave them good job opportunity. And countries like Malaysia and Singapore also started recruiting nurses from 1970s onwards. And even now, this opportunity continues to exist, though the migration has gone beyond Middle East, Malaysia and Singapore to other countries. Now, later in the 20th century, countries like the United States, Canada, Australia and New Zealand became popular destinations. And currently, if you see, European migration is very much popular, and nurses are able to migrate very easily to European countries. And it includes UK, Ireland, Germany, and Scandinavian nations. So this is the history of migration of Indian nurses to other countries, right from 19th century till date. So how this changes are facilitated? Of course, the government is also helping the nurses migrating to other countries. So there are several international recruitment agencies have come to help the nurses to migrate. For example, Kerala has got a overseas development corporation. Tamil Nadu has got a overseas manpower corporation. And recently, our Trained Nurses Association of India, which is one of the largest association of India, of more than 4.5 lakh nurses are members. They also have started recruitment to UK. So like this, reliable international recruitment agencies have promoted the migration of nurses. And if you see, there are also policy changes. Like AIIMS and 7 other colleges were identified to mutually recognize the qualifications between Singapore and India. That means the Indian nurses can, their qualifications are recognized in Singapore. So this will facilitate their migration in a less complicated manner. So like this, the policy changes are promoting similar mutual recognition agreements with other countries also have to be promoted so that Indian nurses will be able to migrate easily to other countries. The qualifications have to be recognized. So these are all the changes which facilitated the migration of nurses to other countries. Why Indian nurses are wanted globally? It is not only the wish of Indian nurses to go to other countries. The other countries are also welcoming Indian nurses. If you see, the Indian nurses are the second largest migrating nurses next to Philippines. And any country we go, we will find an Indian nurse who is contributing to their healthcare delivery system because of the quality of education. The curriculum is such a comprehensive curriculum, and it prepares them to work in multicultural settings. And these are all recognized courses. We have Indian Nursing Council, which prepares the syllabus, periodically reviews, and all the institutions follow uniform syllabus. And English proficiency. The Indian nurses learn nursing in English. English is the medium of instruction. So they are able to adopt and adjust when they migrate to other countries. And diversity exposure. India is a multicultural country, and here itself during the nursing education and nursing training, they are exposed to various varieties of cultures, diversified cultures. So when they move to the other countries, mingling with the patients and families from other cultures is easy for them, and understanding the cultural requirements and exercising cultural competencies are done well by the Indian nurses. And of course, because of the professionalism, the hardworking nature, the ethical practices of Indian nurses, these are all some of the features why Indian nurses are wanted by the countries across the globe. And dedication and hard work of Indian nurses. I personally worked in Army Hospital, Kuwait. So they used to say that Indian nurses work very hard and our hard work used to be appreciated. We work long hours, we work during crisis, and that has been a very appreciable character of Indian nurses. And there is a proven track record because Indian nurses are migrating, as we saw in the history from 19th century onwards, Indian nurses are migrating to other countries and contributing to them. When I visited once in Oman, they were highly thankful. They said the Oman healthcare delivery system was supported by Indian nurses for centuries. So they were so thankful to Indian nurses. So there is a proven track record, and their commitment and contributions have made them a most reliable workforce to depend upon. And of course, cost effective. The countries they find hiring Indian nurses are cost effective for them, and they are eager learners. They continue to learn, and they are willing to adopt and learn and adjust to the situation and contribute and meet the employer's expectations. So these are all some of the qualities which makes Indian nurses globally sought after nurses. But what about the nurses? Is it so easy to migrate to other countries? No, certain preparations are required, and a newly graduating nurse should know the career pathway and the policies, the procedures, how to migrate to other countries. So they require some kind of help, and this gap is being utilized by the recruitment agencies. There are reliable recruitment agencies, and there are recruitment agencies which are exploiting nurses. So this program is the which we are organizing, really it will be helpful for the nurses to know how to migrate to other countries and what are all the requirements and how to prepare themselves in case if they want to migrate and work in other country. The key competencies what they would build in case if they want to migrate to other countries, first is language proficiency. The English-speaking countries want them to appear for English qualifying examinations like IELTS or OET, and certain defined level of proficiency has been required. And there are multiple organizations which are training them. Now the institutions have started training the nurses right from day one they enter into the college or school of nursing, because that 3 years or 4 years duration is quite sufficient enough to build their language proficiency. So in the first year itself, they are asking which country you are interested to migrate. In case if they want to migrate to Germany, then they teach German language right from first year. If they want to go to English speaking countries, then the OET training starts from first year onwards. And if they want to go to Japan and other countries, whichever country they want, they are interested to move, then the training in language starts from first year onwards. Not only in language, of course, in the clinical competencies as well. And they must be familiar with the international nursing regulations and standards. What kind of, for example, if they want to migrate to Middle East, no English examination is required. Only a computer-based test is done. Whereas if they want to migrate to UK, they have to have the language proficiency examination cleared, and there is a computer-based test, and there is an OSCE, which they have to go there and do in the selected universities approved by NHS Trust. So they must be familiar with the international nursing regulations and standards. And of course, if they want to go to US, they have to write NCLEX. And once they write US NCLEX, that is accepted in Canada and Australia. Or if they write clear Australian RN examination, that has been accepted in Canada and US. So the nurses must be familiar with the regulations which are governed by the international recruiting countries. And they should have global health knowledge. Which country they want to migrate, they should know the landscape about that country, which are all the health problems and what kind of patients are getting admitted, and what kind of challenges they will come across. So they should update their global health knowledge, not only learning about the disease conditions which are more prevalent in India. And they must learn cross-cultural communications, understanding the cultural values, respecting them, and communicating in multicultural settings. And research and evidence-based practices also. In this era of consumer awareness, everybody asks for the evidence. So we should be familiar with the evidence-based practices, and whatever we are practicing, we must be able to explain with the research evidence. And digital and telehealth competence. Now, every hospital has, majority of the hospitals are going paperless. Electronic health records have come, and telehealth is become an important component of healthcare delivery after discharge or prior to admission. So telehealth competencies are also required. Nurses can play a variety of role in this digital and telehealth competencies. They can assess the patients, they can interpret the laboratory results, they can interpret the reports of other investigations, they can connect to the relevant consultant, and they can educate the patient and family members, and they can guide them, monitor them, and give feedback to the entire healthcare team, and they can act as a liaison between the patients and families and other healthcare team workers. So this digital and telehealth competence is one of the essential competence required. And crisis management and disaster response. You know, during COVID, Kuwait wanted 500 nurses. Then immediately from here, the Indian government was able to send the nurses to help them in crisis. So similarly, crisis management and disaster response, they must be prepared. Now Israel wants the nurses and other workers and Continuing education, professional development. Nurses need to be lifelong learners because healthcare is ever changing. You should know the newer protocols, newer policies, new equipments which are coming in. Because earlier the surgeries were open surgeries were done. Now those are minimally invasive surgeries, robotic surgeries. So continuing education and professional development is an essential characteristics or competency that nurses should possess especially if they want to migrate to other countries. And ethical decision making, adaptability and flexibility, leadership and managerial skills. These are all the skills which are required if the nurses would like to migrate to other countries. The future, how the future is going to be. Definitely nursing is an evergreen profession. I predict that for next 20-30 years, nurses will be wanted. Definitely Indian nurses will be wanted in all the countries. There is also in-house demand, in-country demand is increasing. So we need to have policy changes and bilateral agreements. So we must have mutual recognition agreements between UK, USA, Canada. They must recognize the Indian qualification and reduce the requirements for migration and help in easy adaptation of Indian nurses. And there must be investments in enhanced education and training. Now the agencies are investing to train the nurses from first year onwards, so that by the time they graduate, they are employable and ready to migrate to other countries. So such investments are required, and there must be increased focus on ethical recruitment, because I was just browsing that how much a nurse has to spend if they want to migrate to other countries. Though recruitment is free, some of the recruitment agencies do not convey this message, and nurses are spending around 3 lakhs, 4 lakhs rupees, like that. That is what the Google survey shows. I think that is a huge amount for nurses to bear if they want to migrate to other countries. So there must be increased focus and awareness created on ethical recruitment. Actually, the recruiting hospitals reimburse all the expenses incurred for getting them ready to migrate to other countries. Like they are reimbursing OET cost, they are reimbursing the CBT cost, and they help in multiple ways. So this awareness has to be created so the nurses do not get exploited and lose money. So these are all some of the future recommendations from my end. And so thank you all for listening. And so continuous monitoring of global healthcare trends, economic benefits, the policy developments. These are the 3 core areas the nurses have to keep in mind if they are planning to migrate to other countries. Thank you very much.